Dental adhesive systems, chemistry, mechanisms, and evolution in adhesive dentistry. Adhesive dentistry is among the most important advances in modern restorative dentistry. The concept supports minimally invasive dentistry, in which the preservation of healthy tooth structure is prioritized. Instead of relying primarily on macromechanical retention, modern restorative procedures depend on the effective bonding of restorative materials to dental tissues, primarily enamel and dentin, through specialized dental adhesive systems. Dental adhesives are polymer-based materials that create a durable interface between the tooth substrate and restorative materials such as resin composites. These systems enable conservative cavity preparations because restoration retention is achieved through micromechanical and chemical bonding mechanisms rather than extensive mechanical undercuts. Over the past several decades, adhesive systems have undergone extensive development. Early bonding materials provided poor adhesion and limited durability. However, advances in polymer chemistry, materials science, and clinical techniques have resulted in sophisticated adhesive formulations capable of producing reliable bonds to both enamel and dentin. Contemporary adhesives can be categorized according to their bonding strategy into three principal approaches: etch and rinse adhesives, self-etch adhesives, and glass ionomer-based or resin-modified glass ionomer adhesives. More recently, universal, multi-mode adhesive systems have been introduced, allowing clinicians to apply the same adhesive using different bonding strategies depending on the clinical situation. Composition and chemical characteristics of dental adhesives. Dental adhesives are typically complex mixtures of polymerizable resin monomers, solvents, initiators, and additives designed to promote bonding between the hydrophilic tooth substrate and hydrophobic restorative materials. Amphiphilic nature of adhesive monomers. A defining characteristic of dental adhesives is their amphiphilic structure, meaning they contain both hydrophilic and hydrophobic functional groups. Hydrophilic components enhance wetting and penetration into the moist dentin substrate. Hydrophobic components copolymerize with restorative resin materials, creating a stable interface. This dual functionality enables adhesives to interact effectively with both mineralized dental tissue and polymer-based restorative materials. Major monomers. 2 monomers are widely used in dental adhesive formulations. 2-hydroxyethyl metaacrylate, HAMA, highly hydrophilic, completely miscible with water, serves as a wetting agent that facilitates infiltration into demineralized dentin. Bisphenol glycidyl metaacrylate, bis-GMA, highly viscous and hydrophobic, primary structural monomer used in composite resins, exhibits limited water absorption, -3 Wt%. Blending HAMA and bis-GMA produces an adhesive with intermediate hydrophilicity suitable for bonding to moist dentin while maintaining mechanical stability. Solvents. Solvents are added to improve monomer penetration and surface wetting. Common solvents include water, ethanol, butanol, acetone. Water and alcohol enhance interaction with hydrated dentin, while acetone can displace water from dentinal tubules. Proper solvent evaporation during clinical application is essential, as residual solvent can weaken the adhesive interface. Additional components. Dental adhesive formulations may also contain photoinitiators, e.g., camphorquinone, polymerization inhibitors or stabilizers, nanofillers or inorganic fillers, cross-linking agents. Fillers can improve mechanical properties and reduce polymerization shrinkage, but excessive filler content increases viscosity and may limit penetration into dentin. Structure of dental substrates, enamel and dentin. Successful adhesive bonding requires understanding the structural differences between enamel and dentin. Enamel. Enamel is highly mineralized, approximately equals 96% hydroxyapatite, and relatively dry. Acid etching produces microporosities within enamel prisms, enabling resin penetration and formation of resin tags. Adhesion to enamel is therefore predominantly micromechanical. Dentin. Dentin is more complex, consisting of approximately 50% mineral, hydroxyapatite, approximately 30% organic matrix, mainly collagen, approximately 20% water. The presence of dentinal tubules and moisture complicates bonding. Adhesion relies on the formation of a hybrid layer, where adhesive resin infiltrates a partially demineralized collagen network. Historical development of dental adhesives. Early developments. The earliest dental adhesive was developed in 1949 by Swiss chemist Dr. Hager, who patented a material known as Severitin cavity seal. The adhesive contained glycerophosphoric acid dimethacrylate, which can interact chemically with dentin surfaces. This concept introduced the idea that acidic monomers could simultaneously etch and chemically interact with tooth structures, a principle fundamental to modern adhesives. Buonocore's acid etching concept. In 1955, Michael Buonocore demonstrated that treating enamel with phosphoric acid significantly improved the adhesion of acrylic resins. Acid etching created microporous enamel surfaces into which resin could penetrate, forming resin tags that provided mechanical retention. This discovery laid the foundation for adhesive dentistry and enabled the development of pit and fissure sealants and composite restorations. Hybrid layer discovery. A major milestone occurred in 1982, when Nakabayashi demonstrated that resin monomers could infiltrate acid-etched dentin and polymerize within the collagen matrix. This resin-reinforced zone, termed the hybrid layer, has been recognized as the primary mechanism of dentin bonding. Factors affecting adhesive bonding. Smear layer. During cavity preparation with rotary instruments, a thin layer of debris known as the smear layer forms on dentin. This layer may obstruct dentinal tubules and interfere with bonding. Adhesive systems either remove the smear layer, etch and rinse systems, or modify and incorporate it, self-etch systems. Moisture control. Proper moisture balance is critical. Overdrying collapses the collagen network, preventing resin infiltration. Excess moisture dilutes adhesive monomers and weakens bonding. Etching time. Typical etching times are enamel, 15 to 30 s, dentin, approximately 15 s. Excessive etching can create a demineralized zone that is deeper than the adhesive can infiltrate, leaving unsupported collagen and increasing the risk of degradation. Polymerization shrinkage and the C factor. Polymerization shrinkage generates stresses at the tooth restoration interface. These stresses depend on the configuration factor, C factor, defined as the ratio of bonded surfaces to unbonded surfaces in a cavity. High C factor cavities, e.g., Class 1 restorations, produce greater contraction stress and increased risk of interfacial failure and microleakage. Generational classification of dental adhesives. Dental adhesives are often categorized into generations reflecting technological evolution. First generation, 1950s. These adhesives attempted chemical bonding to dentin using monomers such as NPG-GMA. Bond strengths were very low, 1 to 3 megapascals, and bonds degraded rapidly in water. Second generation, 1970s. Polymerizable phosphate esters were added to bis-GMA resins to bond with calcium in the tooth structure. However, bonding to the smear layer remained weak, yielding bond strengths of 4 to 6 megapascals. Third generation. These systems partially removed or modified the smear layer through mild etching. Primers were introduced to improve bond strength, but still produced unreliable adhesion. Fourth generation, early 1990s. Fourth generation adhesives introduced the three-step total etch technique, consisting of phosphoric acid etching, application of a hydrophilic primer, application of a bonding resin. These systems achieved bond strengths of 20 to 25 megapascals and established the hybrid layer concept, thereby making them the long-standing gold standard. Fifth generation. To simplify the clinical procedure, primer and bonding resin were combined into a single bottle, while etching remained a separate step. Although easier to use, these adhesives were more hydrophilic and more susceptible to long-term water degradation. Sixth generation. These adhesives introduced self-etch primers, eliminating the separate acid etching step. The acidic primer simultaneously etched and primed the dentin surface. While effective for dentin bonding, their relatively mild acidity produced weaker enamel bonds. Seventh generation. Seventh generation adhesives are all-in-one systems that combine an etchant, primer, and adhesive into a single solution. Although clinically convenient, their high hydrophilicity and water content often lead to reduced durability. Eighth generation. More recent systems incorporate nanofillers to improve mechanical strength and stress absorption. Nanoparticles can increase hybrid layer thickness and enhance bonding performance when properly dispersed. Classification by bonding strategy. Modern adhesive systems are more commonly categorized by mechanism of adhesion rather than generation. Etch and rinse adhesives. Etch and rinse systems involve three steps: acid etching with 35 to 37% phosphoric acid, application of a hydrophilic primer, application of bonding resin. Etching removes the smear layer and demineralizes dentin, 3 to 5 micrometers depth, exposing collagen fibrils. Resin infiltration into this network forms the hybrid layer, while penetration into dentinal tubules forms resin tags, producing strong micromechanical retention. Three-step systems provide excellent durability but require precise clinical technique. Self-etch adhesives. Self-etch adhesives contain acidic functional monomers that simultaneously condition and prime the tooth surface without rinsing. They are classified by acidity. Strong, pH is less than or equal to 1, intermediate, pH approximately equals 1.5, mild, pH is greater than or equal to 2. Mild systems only partially demineralize dentin, leaving hydroxyapatite crystals around collagen fibrils. This allows chemical bonding between functional monomers and calcium, in addition to micromechanical retention. Advantages include reduced technique sensitivity and lower risk of postoperative sensitivity. However, enamel bonding may be weakened by insufficient etching. Glass ionomer adhesives. Glass ionomer and resin-modified glass ionomer, RMGI, adhesives bond chemically to tooth structure through ionic interactions between polyalkanoic acids and calcium ions in hydroxyapatite. These materials release fluoride and exhibit good biocompatibility, making them useful in certain clinical situations such as cervical restorations. Universal adhesive systems. Since around 2011, universal adhesives have emerged as versatile materials capable of functioning in multiple bonding modes: etch and rinse, self-etch, selective enamel etching. These adhesives contain multifunctional monomers, commonly phosphate-based, e.g., MDP, capable of forming stable ionic bonds with calcium ions in hydroxyapatite. This chemical bonding mechanism complements traditional micromechanical retention and may improve long-term bond durability. Selective enamel etching with phosphoric acid is frequently recommended when using universal adhesives, as phosphoric acid provides deeper enamel etching than self-etch chemistry alone. Formation of the hybrid layer. Regardless of the adhesive strategy employed, the central concept in dentin bonding is the formation of a hybrid layer. The hybrid layer is a biocomposite zone created when resin monomers infiltrate the demineralized collagen network and polymerize in situ. This layer typically ranges from 0.5 to 5 micrometers in thickness, depending on the adhesive system. The hybrid layer anchors the adhesive to dentin, seals dentinal tubules, prevents microleakage, provides stress distribution between the tooth and restoration. However, incomplete infiltration or hydrolytic degradation of the hybrid layer may lead to nanoleakage and long-term bond deterioration. Conclusion. Adhesive dentistry has evolved dramatically since the introduction of acid etch techniques in the mid-20th century. Advances in polymer chemistry and materials science have produced sophisticated dental adhesive systems capable of reliably bonding restorative materials to enamel and dentin. Modern adhesives rely on a combination of micromechanical interlocking, hybrid layer formation, and chemical interactions with hydroxyapatite. While early adhesive generations exhibited poor performance, contemporary systems, particularly multi-step etch and rinse adhesives and modern universal adhesives, provide strong and durable bonding. Despite these advances, challenges remain, including hydrolytic degradation, polymerization shrinkage stress, and technique sensitivity. Continued research in polymer chemistry, nanofillers, and functional monomers is expected to further improve the durability and clinical performance of dental adhesive systems in the future.